Humans are usually scared of animal bites. Dogs, cats, raccoons, bats. But do you know whose bites we should really be scared of? Human bites. Hello people, welcome back to Chatterdocs. I'm Dr. Tor and I'm an internal medicine physician. In this channel, I believe that learning about health and medicine does not have to be boring. So if you're new here, I've said this so many times. Subscribe, share, comment, show love. In this episode, I want to talk about human bites. What are the problems and complications that it can cause and how to deal with it if it happens to you. So let's dive in. Actually, one of you guys told me that this hand gesture is Dr. Mike's when he says "bee whoop." Bee whoop. That's true. I mean, I love his work. He's handsome, he's hot, he's a great doctor, and I might have been inspired by his bee whoop. Anyways, not to commit copyright infringement, let's dive in. A few years ago, we had a trauma patient in the emergency department, and the patient was a drug addict under the influence of drugs, so he was violent. And when one of the nurses came to help restrain the patient, he bit her arm here bad enough to penetrate her skin. And after that, unfortunately, that wound got infected. So I saw her a few days after. That wound got red and very painful. It was oozing pus. So we immediately admitted her and started her on IV antibiotics. Unfortunately, that infection was very hard to treat, and she needed a lot of surgeries afterwards to debride the wound and take out the dead and infected tissue. So after multiple surgeries, her arm just got deformed, and unfortunately it was her dominant arm as well. So she became just disabled, in and out of the hospital, multiple different surgeries and antibiotics and pain meds, and she got addicted to the pain meds, and her life was a disaster afterwards. And I saw her couple of years after that in the hospital as my patient again, and I was just like heartbroken. So yes, human bites can be very dangerous and we should know how to treat them. Every year about 250,000 cases of human bites are reported, about 10% of which will get infected with the bacteria that live in the human saliva. Yeah, nasty bacteria I'm talking about. It's more common in men than women because men are crazy and get involved in the fights all the time. And also it's very common in children because children are just stupid as well and they bite each other for fun. It can be a real bite where teeth penetrate the skin, or it can happen when someone punches another person in the face and then that person's teeth will injure the knuckles and fingers of the puncher. Now, what are the signs and symptoms of an infected bite? The wound will have increasing pain and swelling. You may see pus oozing out of the site. The wound will become red and warm to touch. And sometimes you might start feeling fever, chills, and feeling unwell. If the bite happens close to your fingers and you lose sensation on one of your fingers, you may have damaged nerves. And if you lose the ability to move the finger, you may have damaged the tendons. Now, what should you do if you got bitten by a human or any other animal? You should immediately clean the wound thoroughly, ideally with normal saline, which is a sterile salt water, or povidone iodine, and pressured water to remove as much bacteria as you can from the wound. If you see any dead tissue or any debris or any foreign objects, carefully remove them if you can. When should you seek a doctor's help? If the bite happens in sensitive areas like fingers, toes, or around your face, definitely see a doctor immediately. Also, if you experience signs and symptoms of infection that I told you before, and last but not the least, if you have a weak immune system because of a disease or condition or a medication that you're taking, definitely see your doctor immediately. What your doctor will do is they will examine your wound, clean it up, and perform some tests like running cultures on your wound. They may get some imaging like x-rays or CAT scans to make sure there's no broken bone. And then depending on how bad your wound is, they may give you some treatments. In milder cases, they will give you some oral antibiotics and send you home, or they may admit you to the hospital for IV antibiotics. And if the case is very severe, they may get surgeons involved to do some debridements and cleaning up the wound from dead tissue and infected tissue, and maybe close it up with stitches. Or if the wound is big, then you may need a skin flap on your wound and then be monitored further for improvement and healing of the wound. They will also check that you're up to date in your immunization and may give you a tetanus shot. For the soft tissue infection, usually 1 to 2 weeks of antibiotics are prescribed, but if it's more severe like infection in your bones or joints, you may need up to 4 to 6 weeks of antibiotics, even IV antibiotic therapy. Who is at high risk to get infection from a human bite? As I said before, if the bite happens in sensitive areas like hands, feet, face, or scalp, it's at higher risk for bad infections. If you have vascular disease or you're over 50, you are in general at high risk of getting infection from a human bite. Now, what are the complications that you can get from a human bite? Firstly, infections can be transmitted from that person to you via the bite. Infections like HIV and hepatitis. Secondly, as I said before, human saliva contains a lot of bacteria that can be very dangerous. And if you don't readily treat the infection, they can infect your skin, your bones, your tendons, and sometimes cause permanent damage, the same as the story of the nurse that I told you. Sometimes they need to amputate your limb to control the infection, and if the infection is not treated readily and it gets disseminated in the body, they might as well cause septic shock and potentially death in rare cases. Thanks for watching. I hope you never get bitten by any human or any other animals, and if you do, please seek help immediately. If you like this video, don't forget to like it and see my other videos right here.